Hello, I am Dr. S.K Wangnoo, currently working as Senior Consultant Endocrinologist at the prestigious Indraprasth Apollo Hospital, New Delhi. As you know, 21st June is being celebrated all over the world as an International Yoga Day. We, the medical professional, are also committed to give our patients a good life with better heart and the sugar control by means of explaining some of the types of the yoga which are really beneficial for the patient's heart and the blood sugar. Today I am going to talk about some various asanas which has been proved to be very effective in preventing the heart disease and controlling the blood sugars. Let's talk about the Tadasana asana. The Tadasana asanas or the mountain pose is important for the patient's betterment of the heart and the blood sugar control. It basically aligns your body and opens your lungs, boosting oxygen, blood flow and energy so that your lungs get proper energy and heart gets proper oxygen to work in a much better way. Better posture and the heart and the breath means improved circulation of the whole body and more stable blood pressure in majority of the patient throughout the day. Second, it helps your body to use insulin more efficiently, a big win for the diabetes care. So everybody knows that Tadasana is going to be a win-win answer for your heart and diabetes. The third asana is the Vrikshasana, just like the tree pose, where the patient stands erect.
Let's start with Vrikshasana. Right leg, inhalation, keep on the groin of left leg. Now both the hands sidewards, inhalation. Join your both the hands, go behind your ears, focus on one point, turn your palms, exhale. Very gently come down, very gently.
It is a strong booster for your heart health because standing posture will improve your circulation, and because improving the circulation, good nutrients, it goes to all over the body to the tissues which need a good nutrients and trace elements. With that, the body functions much better with the smooth functioning of all the organs of the body, purely because of the improved circulation when you are standing erect. So root yourself, breath deep, stand erect, and let Vrikshasana help your heart stand tall and stand strong. Let's now discuss a very important asana, the Bhujangasana, the cobra pose.
Bhujangasana. Touch your forehead on the ground. Keep your both the hands next to your lower abdomen, upper abdomen, lower chest. Okay, elbows inside. While inhaling, very gently, slowly lift your nose. Okay, for senior citizen, leave your both the hands, lower back upwards, neck upwards, heels together deliberately. Chest expanded. Exhale, very gently come down, touch your both the hands next to your forehead touching on the ground, relax.
With the cobra pose, it opens up your chest, improves circulation, and also gives a improved circulation to the heart. The most important part of the cobra, or Bhujangasana, cobra pose, is strengthen your back. Because when you are stretching your back in a cobra asana, it strengthens and builds your muscles of the back so that you don't get any spinal problems and you feel free and walk straight without any back pain or any joint pains. So by stretching the chest and the lungs, now we are going to discuss Bandhasana, the asana which makes you stress-free and you lead a serene life.
We can do these variations in two different ways. One is excellent person who can perform very well, and second one is the special population who can utilize the blocks or the towel with roll or the blanket, roller blanket below their lower back. Okay, keep your both hands by the side of your body, 1 foot distance between two legs. Now, inhalation, lift your core part of the body and very gently, slowly try to lift upwards as much as possible. Now, those who can utilize the blocks can keep the blocks from down below your lower back and try to hold your position. Stay there, close the eyes and just enjoy the asanas. One of the wonderful asanas to opening your chest. Exhale and slowly come down. Remove your towel, break or blocks. Keep aside.
It strengthens the heart region. By lifting the chest, it strengthens your heart region, improves the insulin sensitivity, relieves stress and anxiety. That means deep breathing is always important to relieve your stress and also boosting the insulin sensitivity, which is important to control your blood sugar. Let's talk about a very important asana, which is called Dhanurasana because it is a bow like Dhanush, which is a bow like structure, which is called the bow pose. And what it does, the Dhanurasana causes increase in the circulation of the abdomen and the chest. By improving the abdominal circulation, it also stimulates the pancreas to release more and more insulin, and by improving the circulation in the lungs, it also increases the lung oxygen absorption capacity. And also when the pancreas stimulates more and more insulin with this asana, there is a good control of blood sugar. So what we tell all our patients that these kind of the asanas are particular for the pancreas in a diabetic patient, where the pancreas is at fault, which is not able to produce insulin, or when the insulin is being produced, it is not acting properly. So with this Dhanurasana, you can improve your pancreatic function, improve your insulin secretion. But let me tell you to all the diabetics that the yoga is important as the adjunctive medicine, as the adjunctive alternative to all your lifestyle modification and the treatment you are taking. It is a sort of a helping hand in all your treatment which is being advised to you by your doctor, and it can reduce the burden of the pills, it can reduce the ongoing long-term complications by improving the or strengthening the pancreatic health. So to all my diabetic patients, I tell them, please practice the Dhanurasana every day in your life to improve your pancreas function.